Hello, everyone. Good morning, good afternoon, and good evening, wherever you are. My name is Shaili Prasad. I'm the Executive Director of the Center for Global Health and Social Responsibility at the University of Minnesota. This presentation is being recorded and will be available at our website in a few days' time. Welcome to our 6th annual Quie and Peterson Global Health Lecture. Planetary Health, Global Health's Next Frontier. This lecture series is hosted in honor of Dr. Paul Quie and Dr. Phil Peterson, the original founders of our Center for Global Health and Social Responsibility. They are pioneers in their field and continue to support the University of Minnesota even today. Their, particularly Dr. Quie's relationship with the university, started in 1958. I know they're watching this tonight, and from all of us at our center and the larger University of Minnesota community, we want to extend our gratitude for their support. Founded in 2017, the Quie and Peterson Lecture is an opportunity to feature renowned global health experts who speak to health challenges around the world. Here is a brief summary of our past Quie and Peterson speakers. In 2017, Dr. Jonathan Patz spoke about confronting the global climate crisis. In 2018, Larry Gostin asked us to imagine global health with justice. In 2019, Dr. Dennis Carroll sounded the warning that many have done. The future is coming. Are we prepared? In 2020, we hosted a panel with Dr. Ilona Kickbush, Dr. Daniel Doss, and Dr. Laura Bloomberg on the topic of health equity and the political determinants of health. And last year, in 2021, our speakers, Dr. Shonjuti Shaha and Dr. Magali Blas, reflected on spillover effects from the COVID-19 pandemic. As I mentioned, this year our theme is Planetary Health, Global Health's Next Frontier. Quite often, global health has been accused of being too siloed and how one particular thought or discipline gets a lot of attention. Sometimes this manifests as the primacy of clinical sciences. We know that with COVID-19 and various challenges that climate change will throw our way, it's important to come out of our silos. And so I'm thrilled to be joined today by our invited speaker who will discuss planetary health, the scientific and social movement, and how global health practitioners can integrate a planetary health lens into their healing mission. It's now my honor to introduce Dr. Renzo Guinto. Dr. Guinto is the Chief Planetary Health Scientist and co-founder of the newly established Sunway Center for Planetary Health in Kuala Lumpur, Malaysia. In addition, he's the Associate Professor of the Practice of Global Public Health and inaugural director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines. He's also a member of the National Panel of Technical Experts of the Climate Change Commission of the Philippines and convener of Planetary Health Philippines, a community of Filipino scholars and practitioners for advancing the new discipline of planetary health. Dr. Guinto's full bio is available on the web page for the Quie and Peterson lecture. If you have any questions for Dr. Guinto, please put them in the Q&A section and I will moderate them. Dr. Guinto, the floor is yours.
Thank you very much, Shaili, for this wonderful opportunity to deliver, for me to deliver the Quie and Peterson lecture. Let me just share my slides. So again, thank you very much to the Center for Global Health and Social Responsibility of the University of Minnesota for this distinct honor, for this high privilege that you've given me as the 2022 Quie and Peterson Global Health Lecturer. Today, I hope that I'll be able to not just share about planetary health, but to convince you that planetary health is global health's new frontier. First and foremost, let me pay tribute to Professor Paul Quie and Professor Philip Peterson, who I believe are in this room or Zoom rather. And so I'm very, very honored to be honoring you through this lecture. And I understand that Professor Quie and Professor Peterson were the ones who made it a point or who emphasized in the University of Minnesota that health is truly global. that we need to be conscious about what's happening around the world, and that our health, our collective health, is shaped by the many global forces, and therefore there is a need to be working with peoples from around the world to be in true solidarity with everybody in order to address these shared challenges. I also perhaps will highlight in this lecture that health is not only global, it's truly planetary. And so again, to Professor Quie and to Professor Peterson, thank you for the positive example that you have showed to all of us. Also, and Shiley, you already mentioned the previous lecturers of this distinguished lecture series. And some of them, actually, I had the privilege of not just meeting in person, but learning from them. You know, you mentioned Professor Ilona Kickbush, who I met very early in my global health career. And I do acknowledge my understanding, the understanding of global health's, complexity, the political nature of global health. I definitely got it from Professor Kickbush. You mentioned Professor Larry Gostin from Georgetown, who is the father of global health law. And, I learned a lot from his work and from his example on how to, use law, international law, to advance health, as you've mentioned, health with justice. And Professor Jonathan Patz, you can see the two of us with Dolly the sheep during the second Planetary Health Conference which was held in 2018 in Edinburgh. And we know Jonathan Patz is one of those who really raised the awareness of the global health sector to the issue of climate change. Before we started looking into it, he already was writing about climate change as a public health emergency. And it's amazing that just last week, when I attended the World One Health Congress in Singapore, I had the privilege of meeting Sanjuti Saha from Bangladesh, a good friend, collaborator, and a fellow decolonizer of global health, and one of Bangladesh's health leaders, outstanding health leaders. We've been working together virtually for the past 2 years, and it was just last week when I met her in person. So, I'm following the footsteps of amazing global health leaders, and I hope that this lecture gives justice to this important named lecturer. Of course, I want to acknowledge, I can't talk about planetary health without referring to the moment where we are in right now. And as we speak, the countries of the world are still negotiating about our future, the future of our people, the future of our planet. As you can see here, COP27, it's been at least 27 years or 27 times since the start of this series of negotiations. For me, it seems that we've been doing too many COPs, but too little action. Sometimes I tend to think, is this truly a cop-out, right? Are people truly negotiating, or are we just trying to evade responsibility towards the people that we serve and the planet that we should be safeguarding? So I hope that, this conversation, this lecture will help us think about what should be, the COPs of the future, and how can the health sector be largely and deeply involved in this cause. So, a few weeks ago, I'm sure we're all aware that the Lancet Climate Countdown released its 2022 report. And, it's been, I think, 7 or 8 years since the first report was launched. And what we will really notice from this series of Lancet annual countdown reports is that, not much is changing. It's the same situation when it comes to the impacts of climate change on health that is being documented in these reports. Perhaps, the data is becoming much more refined and robust as more data is being collected, as the research methods being used being again refined. But it's still the same story, that climate change undoubtedly impacts health, and the health impacts are continuing to be experienced, especially by the most marginalized in the world. And I live in a country that is very familiar to the climate crisis. In fact, over the past 2 years, we've seen the confluence of two crises. On one hand, the COVID-19 crisis, and on the other hand, the climate crisis. And imagine you're a poor Filipino living along the coastlines or along the corridor of the typhoon, and you are confronted with a real dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus? But perhaps the roof of the house will be blown away by the strong wind. Or on the other hand, do I move to these cramped evacuation centers, safe from climate-related extreme weather events? But as you can see in this photo, in these temporary shelters, there's no social distancing to begin with. And so there's a very high chance that you will be contracting the unseen coronavirus in these kinds of settings. So it's the poor, it's the marginalized, it's the vulnerable that are truly impacted by these dual crises of COVID and climate. And apart from the extreme weather events, the Philippines is also experiencing now some of the what we call slow onset impacts or effects of climate change. It's not just about the typhoons and the intense flooding. For instance, we're seeing the fastest rate of sea level rise in the world, around 5 times that of the global average. In fact, the projection is that if climate change isn't stopped, the city of Manila, the capital city of the country, could be underwater by 2050, which can lead to massive displacements of populations. And we should also remember that climate change is not only impacting our physical health, it's also affecting the health of our brains and hearts as well. So there's a very recent multi-country study, a cross-sectional study of young people in 10 countries. And it was found out that among these countries that were studied, the young people of the Philippines were found to be the most climate anxious in the world. Around 90% of the young people surveyed were at least moderately worried to at most extremely worried about their climate unstable future. So climate anxiety is real, and it's already experiencing by many young people around the world. And this is another very recent study just showing to you how vulnerable my country is, not just to climate change per se, but to the different health impacts of climate change. We know that climate change could also spark the next COVID-19 pandemic if we do not get our acts together. And the Philippines is located in what we call an infectious disease hotspot, a place where there's a very high risk for zoonotic spillovers to happen if climate change is not abated. So that's the section of the map that is the reddest or the pinkest, the region of Southeast Asia. So it's very clear that climate change is undoubtedly already impacting the health of the global population, including of my home country, the Philippines. But unfortunately, health is far from being at the center of climate action. Until today, until the 27th COP, health remains to be a side event in the climate negotiations. You might have heard that the WHO and other partners have organized a health pavilion, which started, I believe, last year at COP26 in Glasgow. We still have a health pavilion right now in Egypt. We also know that health is only mentioned once in the Paris Agreement. And to be specific, it's only mentioned in the preamble. It's not even part of the main text of the climate treaty. Health-focused climate funding is almost negligible. So the rich countries of the world committed around $100 billion per year for climate adaptation and mitigation. And those targets or those commitments are still yet to be met and honored. But number two, the health portion of such climate funding is, again, as I've mentioned, close to negligible. And health is also not included in the calculation of the loss and damages incurred by the climate crisis. When we say loss and damage, these are the impacts that already happened and are therefore irreversible. And when we talk about loss and damage, still, right now, we're still very stuck with, measuring impacts on property and livelihood and agriculture, but not so much the physical health impacts, more so the mental and emotional loss and damage that many people around the world are already experiencing, especially in climate vulnerable countries. But it's also not just that health is not in climate. Climate change isn't in health either. So unfortunately, medical and health profession schools around the world largely are still not teaching climate change. There's one survey conducted by the International Federation of Medical Students Associations, or IFMSA. Only 15% of medical schools around the world have incorporated climate change into their teaching and education and training. Global health organizations, whether the funders or the implementers or the policy organizations, everyone is still operating as if the climate is stable. Climate change is not part of the global health agenda or not part of their organization's strategies, more so in the delivery of healthcare around the world, especially in low middle income countries. Health systems are also emitting carbon. Around 5% of the global greenhouse gas emissions of the world is coming from the health sector. And we're also not adapting to climate change. We have health systems around the world that are unready, not prepared, and have not incorporated climate considerations into healthcare design and delivery. And of course, right now we're still in the middle of the pandemic, especially in this part of the world. I understand in the US, in some parts, or maybe in the whole country, there's already a recognition that COVID is over, but we have to remember that in the spirit of global health equity, it's not yet over in most parts of the world. And we thought that COVID-19 as a public health issue will help raise awareness around the world regarding the links between climate and health, but COVIDization didn't help. In fact, the health sector was further distracted away from climate action. And so we've seen a slowing of progress rather than an intensification, again, because everybody is focused on a single virus. We know that global health is about equity, but also we know that global health is also a very colonial field. It's rooted in colonial history, and until today, it continues to behave in many colonial ways. And this caricature from an article that I co-wrote just describes the different facets of global health's coloniality, and that's why you must have heard about this emerging and ongoing discourse around decolonizing global health, that we need to dismantle power asymmetries, white supremacy, racism, and patriarchy that underpin, that characterize our field and our sector. And part of this coloniality of global health is this idea that, global health and humanity in general can also colonize nature, the environment, the climate. We've already described as well the climate crisis as another form of atmospheric colonization. And so when we talk about decolonizing global health, we must also talk about decolonizing global health's and humanity's relationship with nature, with Mother Earth, our only home. And sadly, and I already alluded to this already a while ago, global health is not only colonial towards nature, it's also not climate conscious. And we've seen this, especially over the past 2 years. We've deployed, many different health services and health commodities without really thinking about the footprint of such activities and products on the environment. Our vaccine campaigns around the world are still largely not considerate of the climate. We're still yet to see innovations and programs that try to reduce the carbon footprint of the vaccine supply chain. On the other hand, we still have health systems, as I've mentioned, that are unready for the climate crisis and its myriad health impacts, as you can see in this hospital that is inundated by intense flooding related to a storm. And so I begin to wonder, does global health need a new paradigm, lens, approach, discipline, in order for it to become more climate conscious, in order for it to start taking good care, not only of the people that it ought to serve, but also of the planet where its patients and its people do inhabit. And so in 2015, the Rockefeller Foundation and the Lancet came together to publish this report of a commission, the Commission on Planetary Health. And here, as you can see, planetary health has been described as the new discipline that is needed for this new era, this new time. And if we want to safeguard human health in the epoch of the Anthropocene, which I will describe to you in a bit, we need a new discipline. And the proposal was that is what we now call planetary health. Let me remind you about the definition of planetary health. It's the health of the human civilization and the natural systems on which it depends. There are several definitions of planetary health that have been proposed, but this one is the seminal definition that is enshrined in the Lancet Rockefeller Commission's report. As you can see here, we're not just anymore talking about the health of people, we're also talking about the health of the natural systems on which it depends. And the way I summarize it as a physician is that in planetary health, we now have two patients, not just the people, but also the planet. Another way of looking at it is that we have these two patients. On one hand, we have this kid who is wearing a face mask, trying to protect herself from the unseen coronavirus. And on the other hand, we have Mother Earth also wearing a face mask, of course, not to be protected from SARS-CoV-2, but instead to be safeguarded from the myriad planetary health damages that are created as a result of our human activities. But some of you might be wondering, is this truly a new concept? We know that it's not a novel invention. The term planetary health may sound new, but actually the concept, and the principle that the health of the people and the health of the planet are inextricably intertwined. Again, it's not a new idea. And I think colonial, quote unquote, global health must start listening to indigenous wisdom, to the indigenous communities of the world, which have been embracing this idea of the inextricable link between the health of people and the health of the planet. According to Chief Seattle, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. So now let me proceed to sharing with you some of the key principles or tenets of this new concept of planetary health. And one of these is this concept of urgency. So in global health, we are used to setting targets, zero-free malaria, or zero rabies, or zero HIV/AIDS by a certain year. That's what we do in global health. Meanwhile, in planetary health, it's actually not us who are setting these targets or deadlines or tipping points. It's Mother Nature. We know that we need to keep the global average temperature increase to below 1.5 degrees Celsius by 2030, if we want to prevent and avoid the catastrophic impacts of climate change to be experienced, especially by the world's vulnerable. That is something that we did not set. It's something that Mother Earth is telling us to observe and to respect. And so these deadlines, these limits should be a cause for urgency within the global health sector, within the planetary health community. And as you can see here, an emergency needs urgency. So unfortunately, as I mentioned, we are not acting, quoting Greta Thunberg, as if our house is on fire right now. We need a greater sense of urgency to tackle pressing planetary health problems that we're facing. Another key principle or tenet is systems thinking and interdisciplinarity. And in planetary health, we acknowledge that the different systems that constitute the planet are connected to one another. What happens to our cities affects another part of the world or another component of the planet. And so this is an invitation for us to embrace true transdisciplinarity, because we cannot solve these problems alone if we stay within our silos, if we stay within the silos of our disciplines. So as you can see here, we need to start looking at not just the health of people, but also the health of animals, plants, and other life forms that inhabit the earth. But also we need to examine the abiotic factors that constitute the planet, the land, water, and air, and also the human systems or the social systems that drive planetary health damage. The way we design our cities, the way we produce our food, the configuration of our economies, the nature of our politics. And so it's important to engage, especially the social sciences and the humanities, in diagnosing planetary health problems and in designing planetary health solutions. I already mentioned the Anthropocene a while ago, which is another key principle in the planetary health field or concept. The Anthropocene is a proposed new geological time epoch that acknowledges the fact that we live in this era where it's not natural phenomena that are truly shaping the health and well-being of people and of the planet. It's actually us, our human activities. And I'll not go into the details of this diagram, but as you can see, our consumption patterns, the demographic shifts that we experience, such as continuous population growth and urbanization and technological advancement, all of these are driving massive global environmental change, which is in return impacting the health of human populations, such as the many impacts that I shared with you early in this lecture. And so if we do acknowledge that we live in the Anthropocene, then we will not be merely depending on the clinical solutions that we're more familiar with, or even the health sector solutions that we've been utilizing in the field of global health. Instead, we will be addressing the root causes of these anthropogenic global environmental changes. And in relation to the Anthropocene, another principle is a principle of the planetary boundaries, or the concept of the planetary boundaries. In health, in the field of global health, we do have health metrics or health indicators that we monitor over time: life expectancy, maternal mortality, infant mortality, etc. But when it comes to the health of the planet, we should be all concerned about the limits or the boundaries of the planet, the limits that Mother Earth gave to us and that we need to respect and not breach and not violate. So I will not go into the details, but according to the Stockholm Resilience Center, there are 9 planetary boundaries that have been identified. And out of 9, unfortunately, as of a few weeks ago, 6 have already been violated. Okay? Novel entities, which is the boundary pertaining to new compounds and chemicals that we manufacture in the lab, particularly plastic. Of course, climate change has already been violated, meaning we're not on track to reach the objectives, the goals of the Paris Agreement. Biosphere integrity. Over the past century, we've seen the fastest rate of extinction of creatures great and small. The boundary for land system change, because we've been turning rainforests and other natural ecosystems into cities and golf courses and factories and subdivisions. The natural biogeochemical flows of phosphorus and nitrogen have also been disrupted because of our addiction to chemical fertilizers. And as I mentioned, the sixth planetary boundary, which is yet to be shaded in this diagram, is the boundary for fresh water use, because we've already overused and contaminated our lakes and rivers around the world. So 6 out of 9 planetary boundaries. This should be a cause for great alarm for the global health sector, because these boundaries, the breaching of these boundaries, pose an existential threat for our common humanity. Another important principle is the principle of intergenerational equity and responsibility. In public health, in epidemiology, there is a tendency to focus on the health of people who are living today, and we try to diagnose the health issues, the spread of disease within a population who are living and existing at the present moment. But in planetary health, we're not just concerned about the health of people who are living now. We are also concerned about the health of people who will be living 100 years from now. And that is what the concept of intergenerational equity and responsibility is truly about. Here there's a quote from Greta Thunberg. You say you love your children above all else, and yet you are stealing their future in front of their very eyes. That is, a total lack of intergenerational responsibility. We are even colonizing, the ability of future generations to live and thrive. And so this is, again, another central principle in planetary health. So I just shared with you some examples or some principles of this emerging planetary health field. And you might be wondering, how can global health, become planetary health, or what is the connection? There are several potential interpretations, and these are only 3. One is that the global health field and the global health sector perhaps must start adopting a planetary health mindset lens or approach. Another way of looking at it is that global health, which is the health of the global population. If you notice, global health, like planetary health, also has many different definitions. Another way of looking at it is that global health of people truly depends on planetary health, which is the health of people and the planet, as I've defined to you a while ago. And another interpretation is that global health could transform into this new discipline or field of planetary health, which has a much broader scope and view, with a deep concern not just for the health of people, but also for the health of the planet. Regardless of which interpretation you choose to espouse, I think what's important is that the planetary health principles that I described to you a while ago become truly embraced by our sector, by health professionals, and are applied to our healing mission. So now maybe you're wondering, how do we operationalize planetary health? And again, this is a new field, this is a new discipline. And so it is a space that is open to creativity and innovation. But let me just share with you some examples and some, buckets of ways by which we can operationalize and turn planetary health action into reality. First, we can bring planetary health inside the clinic, whether in terms of enhancing our ability to treat and manage climate-sensitive diseases such as heat-related illnesses. We do not spend a long time in medical school learning about heat-related illnesses. Maybe now is the time to do so. All the way to incorporating clinical care into nature conservation. So I would just like to share an example of a nonprofit based in Indonesia. It's called Health in Harmony, which have been providing clinical care to people living in rainforests so that people will stop cutting trees for healthcare expenditure and instead help in nature conservation. And there was a study that was published in PNAS showing that providing medical care to people in these situations indeed leads to a huge decline in deforestation. And of course, that also has huge benefits to carbon sequestration and climate stabilization. So we can bring planetary health at the level of the clinic. We don't need, or if you're a clinician, there's already something that you can be doing at the level of the clinic in the workplace alone. But also entire health systems can become planetary health oriented, can become climate smart. Climate smart is a concept that is the convergence between sustainability, making sure that our health system is not contributing to the climate crime, to carbon emissions, while at the same time, our health systems are also resilient and adaptive to the impacts of climate change. We need to make sure that our sector is the last sector standing in the face of the climate emergency. And so, these are just some of the actions that we should be doing if we want our health systems to become climate smart, sustainable, and resilient. But we also need to go outside of the health sector. We need to be working with other sectors. And one of the frameworks that we can embrace and espouse and implement is the nexus approach. In particular, in sustainability sciences, there is this concept called the WEF nexus, the water, energy, and food, which are all vital for the improvement and the promotion of health. But we seldom talk about working with the energy sector and the food sector and the water sector in order to achieve our human and planetary health objectives. So maybe now is the time to step out of the clinic and of the healthcare system and engage with these new allies in the promotion and improvement of people's and the planet's health. And another way by which we can realize planetary health and turn planetary health into action is by promoting nature-based solutions, such as nature conservation, forest conservation, mangrove planting and conservation, rewilding and creating of green spaces in urban areas. Nature-based solutions should be part of our therapeutic toolkit as planetary health physicians, nurses, and planetary health professionals in general. And ultimately, if we want to reverse the planetary health damage that we're seeing around the world, if we truly want to address the root causes of the planetary health crisis, we need to be engaged in the broader discussion around transforming the economic model that we have, the economic model that created these problems in the first place. This economic model that encourages continuous growth and capital accumulation, and that does not respect the planet's boundaries. And so, for instance, one alternative economic model that has been proposed is the donut economy model that was developed by this British economist, Kate Raworth. And as you can see here, it looks like a donut. I know donuts are not necessarily the healthiest food out there, but perhaps this is the healthiest donut ever to be baked, because this is an economy that respects the ecological ceiling, the planet's boundaries, while at the same time meets the basic social foundations of humanity: food, water, health, education, energy, housing, etc. In fact, there's one city already in the world that has committed to embracing and realizing the donut economy as their model for their post-coronavirus economy, and that is the city of Amsterdam in the Netherlands. I invite you to Google about the many initiatives that this city has been implementing for the past 2 years. So I'm reaching the end of my talk, and if we want global health to become more planetary health oriented, if we want global health to start caring not just about the health of people, but also the health of the planet as well, we need to expand the movement. We need to start spreading the positive virus of planetary health to the world. And that should start within our sector. And that's what I've been doing for the past several years, trying to promote planetary health, especially in my part of the world, Southeast Asia. And over the past 2 years, in the middle of the pandemic, we were able to establish not just one, but 2 centers of planetary health in Southeast Asia, one in the Philippines at the St. Luke's Medical Center College of Medicine, and another one in Malaysia at the Sunway University. And our mission, our goal is to establish more planetary health centers, networks, not just in Southeast Asia, but around the world, especially in the global South. We should also start influencing the worlds of policy and education. We need to influence the leaders of today and the leaders of tomorrow. And so, for instance, in Malaysia, we were already able to influence national policy making. The 12th Malaysia Plan of the country has mentioned the phrase planetary health 7 times. That's a great achievement. We've not seen yet any government policy document that has made a reference to planetary health. And I hope that more governments will follow suit. And in the realm of education, we're already beginning to develop courses for the young and the young at heart in order to raise planetary health awareness and consciousness. And we're doing it with an Asian flavor, because we know that if we want to realize planetary health in our part of the world, it has to be contextualized, it has to incorporate our cultures and traditions and philosophies. And so it is very important that when we bring planetary health to different places, we are taking into account the different geographies and cultures of the world. We established a national planetary health network in the Philippines. You can visit planetaryhealth.ph, and you will find out more about this growing community of scholars, advocates, and practitioners who are promoting planetary health in our country. Because, as I always say to my colleagues, if California has a Silicon Valley, which is the global epicenter for technological innovation, the Philippines can be the Silicon, not Valley, but islands of planetary health innovation. We will be finding the solutions that will tackle the planetary health problems that we are facing today, and we hope to share those solutions to the rest of the world. So now, let me conclude. This pandemic has been described by the great Indian novelist Arundhati Roy as a portal, as a gateway between one world and the next. And every time we travel to a new place, we go to a new destination, we need some source of information. We need something to tell us where to go. And in the ancient times, they use a compass. In the 21st century, no one uses a compass anymore. Instead, we use a Google map. So what is the Google map for our future, for the future? And I think that new compass, that new Google map is planetary health. It's a compass that we need towards a green, healthy, and just, quote unquote, post-COVID future. And I know that some people are saying, and I think there's a growing recognition that COVID is here to stay. But I'm using COVID here as a moment, as an era. And after this pandemic, there needs to be a true transformation, and a transformation that is geared towards, again, a green, healthy, and just future. We cannot go back to the old normal, which is abnormal. We need to move towards a truly new normal. And we can only do that if we will renovate the political economy of planetary health. We cannot just be putting out fires. We need to be addressing the root cause. And again, we need to shift away from this old classical economic model and instead move towards a new economic model, perhaps a donut economy that respects the planet's boundaries while at the same time meets the needs of all people, not just of some. I think planetary health is also an invitation to planetary humility. It asks us to shift away from this ego-logical perspective. Oh, we are at the top of the pyramid of nature. We can consume, kill, extract, mine, contaminate, pollute, and instead we need to shift towards a truly ecological approach where we human beings live in solidarity, in greater interdependence with all creatures great and small, and all the other components of planet Earth are one and only home. And finally, I think that planetary health is an invitation for us to become good ancestors. What we want is that in 2122, which is 100 years from now, the children of 2122 will read the history books, will look back to the past, and they will say that the COVID and climate generation of 2022, which is all of us in this event, in this lecture, have been good ancestors to them because we made the right decisions, not just for our own health, but also for their health and well-being as well. We are not selfish ancestors. We are good ancestors for these children and the future children of the world who are yet to come. So together, let's advance the health of people and planet. Thank you very much.
Thank you, Renzo. I really appreciate that wonderful presentation. I'm energized. I know it's evening time here. I'm ready. Here are some questions, and we've been getting a few of these questions coming in the Q&A section. And this is just a reminder for others. You can put your question in the Q&A box, and I will moderate them. The first question goes towards your ego-logical model point, like the historian Yuval Harari mentioned, that sapiens has been destroying pretty much everything in the past. So where does population control come into this equation? Is our footprint too big on planet Earth?
Thank you very much. And, population control, I think, is a term that we've been trying to avoid, right? In the field of global health.
Yep.
I guess I would say that, and I already mentioned that already a while ago, that we need to tackle our continuous population growth, but we also need to tackle other underlying drivers of anthropogenic global environmental change. It's not just that our population is continuously growing. Our people are also moving to cities, and the cities are also expanding. We're destroying the forests and the natural ecosystem surrounding them. We are also continuously using products, right? Or even overusing products and creating new products. Many of them we don't truly need, perhaps. And so, yes, we need to address population growth, and it's going to be a very difficult conversation to have because, when we talk about that, that very sensitive issue, there's a tendency to go back to the old ideas, right? And I don't want to expound on them, but also what happens is that it's all about low and middle income countries again that are, the culprit of this crisis, because these are the parts of the world with huge population sizes, when in fact, we're not looking at the per capita emissions and consumption of people. And, people in the global north undoubtedly does have a huge, very large footprint, environmental footprint on an individual level. So it's not an easy question, but there certainly are different aspects that need to be considered. But also, as I've mentioned, there are also other underlying drivers that need to be addressed as well. So and I hope that the global health field will first acknowledge that there's a planetary crisis, that we need to embrace the principles of planetary health. Okay? And I already gave you some potential trajectories. And then we can start talking about population and family planning and non-communicable disease and infectious disease in the light of these planetary challenges. Unfortunately, those discussions are not happening until now as we speak.
Thank you for that, Renzo. A few folks have this question about terminology. One Health, global health, planetary health, environmental health. Are they different things, different terminologies for people? And is that causing part of the problem? Because each one is defining, like your elephant, defining the challenge in different ways.
Right. And you know, sometimes the way I describe this debate or even confusion is that we're all looking at the same elephant, but we're just looking through different angles, right? The planetary health folks are looking at perhaps the ear, while the One Health folks are looking at the tail, right? Yep. But we're all trying to solve similar, if not the same, problems of climate change and how it's driving new pandemics and vector-borne diseases, or how urbanization is leading to air pollution that creates or exacerbates respiratory diseases in cities. So on one hand, I tell people fundamentally, I'm agnostic to these terms. What is important is that we understand the issues that we're trying to solve, and we focus on the types of solutions that are needed. And the solutions cannot be business as usual. They have to be cross-sectoral and transdisciplinary in nature. We need to do them with a sense of urgency. In a way, the principles that I mentioned to you a while ago. But also on the other hand, and the academics, they love creating terms and then debating about them, right? And writing about them. So we're really part of the problem. I think it's also important to have an understanding of the disciplinary evolutions of these terms, not to really dwell on the differences and expand the divide, but instead to find the synergies and the commonalities.
Yeah. Sorry, folks. Oh, there you are. Renzo, we lost you for a...
Hello, Shiley?
Yes.
Am I back? Yeah.
Yeah, you're back.
Okay. It might be one of the Wi-Fi hiccups early in the morning here in Southeast Asia. So, Shiley, what was the last word that I said? And I'll continue.
You were talking about the disciplinary evolution.
Right. So, it's also important to have some understanding of the disciplinary evolutions of these terms. One Health is a concept that our veterinarian friends do passionately advocate for. It's coming from this recognition that there are animal health issues that are also shared with human health, right? And that's great. Planetary health, as you already heard a while ago, it was first introduced in a medical journal. So it's really coming from physicians and public health folks who realized we cannot be treating sick people living on a sick planet. But again, fundamentally, the principles, the values, the issues that we're trying to address are pretty much the same. And so, my dream is for the One Health, planetary health, eco health, global health leaders to just sit down inside a room, maybe in Geneva or maybe in the global south, and then come out of the room with a consensus on the way forward.
Wonderful point, Renzo. I feel sometimes that we are in a war of semantics, where the town is burning down in the meanwhile, right? Along with what you just mentioned, who is not at the table? Yes, we are multidisciplinary, we need to include, but at this time, who is not at the table?
Excellent question. So, and there are many layers to that question. Within the health sector, who's not on the table? Well, many of our colleagues from the clinical side of medicine, and also on the other hand, the nurses and other allied health professionals. I just want to give a shout out to Teddy Potter, who is leading planetary health in the nursing school of the University of Minnesota. We need more Teddy Potters in the world. So within the health sector alone, there are marginalized voices, or there are voices and perspectives that we haven't heard yet, right? That we have not invited yet to have a seat around the table. But outside of the health sector, there are many voices that need to be included as well. I mentioned that fundamentally what needs to be changed is the economic model that created the planetary health challenges, the planetary health crisis in the first place. So we need to talk more, to have more conversations with the economists and, learn from them, but also try to change their classical way of thinking about the economy as if the planet does not have limits. We also need to work closely with philosophers and ethicists, because you probably have gleaned from my presentation, planetary health also raises a lot of moral, ethical questions about humanity's relationship with the planet Earth, with animals, with plants. So those are just some examples of disciplines that we need to be engaging more and more if we want to advance planetary health. So there are other voices that we need to also make sure are engaged, right, in planetary health. Marginalized communities in the climate front lines, people with lived experiences, young people experiencing climate anxiety, indigenous populations that have been previously colonized, that continue to be colonized, and are now fighting the climate crisis, which is not their own doing in the first place. So these are the voices and the perspectives that need to be represented around the table.
Here is a question that is a summation of many questions that have come in the chat box. How do we educate the younger generation all the way to elementary school? And what is missing in our current health professional education that we can do better in terms of planetary health, the need and urgency for it too?
Great question. Yes, of course. We need to educate the young people about planetary health so that they will not repeat the same mistakes that the previous generation did. But this is the thing with planetary health and the problems that we're trying to address. We have deadlines that need to be met, and we need to embrace a deep sense of urgency. And so it's not just the young people who will be the leaders of tomorrow that needs to be educated. The adults of today need to be re-educated and re-educated fast. Because, as the hours go by and we're still uneducated about planetary health, we continue to destroy the planet with our decisions and our behaviors. So I think we need to be educating the young at heart as fast as possible. We need to educate the leaders and the diplomats, the negotiators who are now negotiating again in COP27 without us, who are the generation that will be impacting not only by the climate crisis, but the results of their inaction and their indecisiveness. So I know that is a large agenda, right? Because we're now trying to basically change people's mindsets and behaviors. And again, time is running out. And so we need to, start thinking of other ways of educating an entire global citizenry about planetary health beyond the formal education. Because, the young people, yes, they will study about planetary health. In fact, I think they're more aware now. They're the most aware generation because they're already seeing climate change and planetary health even online. But I'm more concerned about the adult generation that are already making decisions, both good and bad, that will have implications for the future of the children that we're trying to educate about planetary health.
Excellent point. While we're talking about the education part, one of the questions that came up really intrigued me. Are there legal frameworks for us to explore in this space? And are you aware of any legal frameworks around the world emphasizing the need for planetary health?
Of course, my dream is for us to have a global treaty for planetary health, right? And if we do have that international legal instrument, it will cover many of the pressing planetary health challenges that I've enumerated already in this lecture.
Yeah.
But what do we have right now? We have a fragmented global health and environmental legal system. We have a treaty for the climate crisis, Paris Agreement, which is still hugely a compromised international legal instrument. Meanwhile, as we speak, a new pandemic treaty is being deliberated under the auspices of the WHO. And the hope is that that new treaty will have a One Health or a planetary health emphasis, so that the treaty will not only address issues like reporting of outbreaks or vaccine and diagnostics development, but also preventing pandemics from happening in the first place by addressing the upstream drivers like deforestation, biodiversity loss, and climate change. So that's my response. Right now the laws, the international laws that we have are inadequate, fragmented. There are many gaps, and my dream law is something more encompassing. Of course, the more encompassing the law, the harder for countries to negotiate, because fundamentally planetary health is an issue of economics and politics. And I guess apart from educating the young and the young at heart about planetary health issues, we need to equip ourselves with the political skills in order to navigate these complex conversations and to be able to negotiate and advocate for better planetary health.
Renzo, I think you hit on the point very strongly here, and even in your presentation, the need for a multidisciplinary approach. Quite often we think of physicians being the answer to a lot of solutions, but we are not. We are just one part of a large equation. What can we do from the health professional viewpoint in creating those bridges, in influencing what you talked about, the larger political discourse, the economic discourse that's happening, right, which are probably bigger levers than what we can accomplish in our own silos?
Correct. And in a way, you alluded to it already. Yes, we need to tackle the big monsters, but we also need to do the baby steps, and perhaps in a very rapid manner. And that's why in my talk, I highlighted that planetary health, it may have the term planetary in the phrase, but planetary health can be brought to the clinic, can be brought to the level of the healthcare system. We need to put our own house in order first. Okay? If we want to be credible advocates for planetary health to other sectors and to the broader society and the broader community, we need to show to them that we've done our part in decarbonizing our sector, in educating our own workforce about climate change and planetary health. Why will other sectors follow our prescription if we ourselves are not following our own prescription? And of course, in medicine, many of us are guilty of that, right? Uh-huh. We prescribe different things to our patient, and we don't follow, those healthy, life-saving prescriptions. It's the same thing for planetary health. We can start reimagining the future of healthcare delivery that is not only of high quality and that is accessible to people, but also low carbon and considerate of the climate.
A wonderful point. I think all of us have a role to play in this, but we need to get our house in order. Here's a question that goes back to what you mentioned about the burden of some of the changes, right? In some ways, the folks from poor regions of the world will bear a burden of this. What is it that we can do to listen to the voices of communities, number one? And on the flip side, also bring in more engagement from all communities, not just the communities that might be disproportionately affected. For example, like you pointed out in Manila. How can we get other communities also respond to this in an urgent manner?
Right. Well, I think, that can be done also at all levels from local to global. I would love, for example, the next rounds of climate negotiations to have more of these, again, unheard voices to be truly represented and heard. These COPs, they will give speaking slots to the health professional, to the indigenous person, etc. And then after that, they just return back to their normal agenda.
Yeah.
Geared to delay climate action and protect corporate greed and certain countries and sectors' interests. So at the global level, something needs to be done, something can be done. But for example, and to make it more, I guess, resonant to our health professionals who are listening, at the level of, care, or, when we are designing community health projects, or for those who are doing global health projects overseas, one way to really address planetary health, or to incorporate planetary health into our global health initiatives, is to listen to what people are saying in terms of what they're beginning to experience about climate, regarding climate change or the climate impacts on health. And a while ago, I mentioned that global health organizations are still operating as still the climate is okay. And one manifestation of that is many of our global health projects, whether it's for HIV or maternal and child health or tuberculosis, they are not taking into account that the populations that these programs are serving are also beginning to be affected by climate change. So if we listen to the people who are in the front lines, who are already experiencing these climate impacts firsthand, then probably we will be seeing a new generation of climate smart HIV/AIDS programs, climate sensitive mosquito-borne disease vector control programs. I would like to see more of those projects and programs that really try to bridge climate change and health. But then we can only achieve that if we listen to other voices, to communities, and also to other disciplines and sectors in the countries where we are operating.
It's I think an important message for us. We should move away from our single disease approaches, because we are not achieving much in that disease, number one, and we're not creating resilience in our health system. So thank you for that. I'm sorry, folks, I won't be able to get to all the questions. I know we had a wonderful lot of questions. In the interest of time, I have to wind down the Q&A section. Thank you, Dr. Guinto. This was wonderful. Thank you all for participating. My thanks are also to the members of my center. They are the ones who make this absolutely brilliant. Anna Pendleton and Katie Griffin, who've been working in the background to make this happen. I want to especially thank Dr. Paul Quie and Dr. Phil Peterson, after whom this lectureship has been named. As long-standing leaders within our global health community and as the founders of our center, they've built this platform we are now using to strengthen the University of Minnesota's ties with partners around the world. This year is our 6th annual lecture. Please go to our website, globalhealthcenter.umn.edu, to see all of the work that our center is engaged in. A recording of this presentation will also be at that in a couple of days' time. I also want to thank a whole host of folks who've been strong supporters of our center. I see a lot of them in the audience today. We understand the role you play in influencing us, in making our work so much better. I have 2 quick asks of you today. One, we love for you to fill out a survey that you will receive. We treat this survey with a lot of respect. We want to make improvements for all our engagement activities. And secondly, please consider supporting the work of our center with a gift to the Quie and Peterson Fund, so we can continue to provide you with webinars and other engagement activities like this one. And again, on behalf of our entire staff from the Center for Global Health and Social Responsibility, Thank you, thank you, thank you. Dr. Guinto, special thanks to you.
Thank you very much.